Hello, everyone. Welcome to the IIFX Town Hall. Today's subject is COVID's impact on the sports and entertainment industry. Our industry has been asked to navigate our way through this latest surge. We have been inundated with information about COVID-19. Every day brings a new study, recommendations, or contradictions of previous policies. One thing we know is that COVID-19 essentially wiped out our 2020 sports and entertainment year for fans. While things looked up in 2021, Omicron appeared and had an impact on our industry. How will the pandemic unfold for our industry in 2022 and possibly into 23? I want to thank up front here the physicians for supporting this important town hall, and thank you also for attending this town hall. Well, let's get started. I'm going to turn over the program to Dr. Michael Anderson. Dr. Anderson?
Thanks, Luke. Can you hear me okay?
Yes, very well.
Good day, everyone. So glad to have folks willing and able to listen to updates from, I think, a terrific panel of physicians. And you can see we've assembled folks from all over, literally all over the country to speak to this town hall. So Dr. Till Jolly, who's the Chief Medical Officer at Aveshka, and I also work for Aveshka. I contract with the federal government on issues and also work at Children's National. Till will be along in just a minute. He is so talented that he is needed in a number of different quarters. And I will ask each of my esteemed physician colleagues to introduce themselves as their part of the presentation comes up. I want to thank everybody for not only being here, but also submitting your questions ahead of time. And we're going to sort of ask and answer our own questions as we go along. And when Till joins us, he's really a maestro of being an MC and can weave all of our presentations together. So once again, thanks for taking time out of your busy days to talk about what are we going to do going into 2022. Next slide. So I'm a pediatric intensive care doc. I'm an optimist in life. I think most times you meet pediatricians, we're optimistic people, but I'm going to bring a little dose of reality. Our kids are hurting right now. Of course, all of us, after 2 years of this horrible pandemic, are exhausted. We're tired of this. We're sick of either the politics or the masking or the changing guidelines. But I just want to take the plane to 30,000 feet for a moment, because so much of what we do in IIFX is about kids, either kids as fans or kids as participants or families. So I just want to take a little bit of a snapshot from my vantage point as a pediatrician, a father and a grandfather, what's going on in the pediatric issues and the pandemic response. By the way, I am a federal contractor, and this is in no way any opinion of the United States government. I just provide my expertise. You can't wake up any morning without headlines, and it's headlines about politics and everything else. But this is an NBC headline from this morning, and the number of cases of kids with COVID is continuing to spike. And once again, last week, 1 million kids tripped positive for novel SARS-CoV-2 or COVID-19, most likely the Omicron variant, as we've learned, and you'll probably hear from other colleagues, an incredibly contagious variant of novel SARS-CoV-2. And the fact that we have just astronomically and logarithmically gone up on the number of kids that have become infected is really disconcerting. As everybody knows, there's good news. Kids do not seem to be as negatively affected as adults, but they are affected. And I'll dive a little bit into what those numbers mean in the next slide. But once again, waking up, preparing for this webinar, there's the NBC headline. Skyrocketing number of cases, just under 1 million new cases in kids under the age of 18 from January 6th to January 13th. Underneath the hood of this, it is good for me, I think, as a child advocate. It's good to see as a child advocate, all these organizations coming together to monitor how many kids are testing positive, to monitor what's going on in pediatrician and family medicine and children's hospital offices. But the market increase in the Omicron numbers or the general numbers of COVID cases in kids is really disconcerting. Once again, the bottom line for kids in general is seem to be less severe symptoms. Most kids without comorbidities are going to do just fine. But there's a lot of kids that are vulnerable. There's a lot of kids that do have pre-existing conditions or comorbidities. And those kids are starting to feel the effect of this virus or continuing to feel the effects of this virus in a big way. Next slide, please. This is from the CDC website. You can go on once a week and check it. You can see on the left-hand side is the number of kids admitted for COVID-19. It's a strange statistical number, which is sometimes difficult to get your arms around. It's how many kids per 100,000 population. On the right is all of us lumped in together. And you can certainly see that January. On the far right, that January spike of all patients getting admitted for COVID. And the yellow line at the bottom is kids 0 to 17. The left-hand part of this CDC document, which is updated every week, is the number of kids admitted. So it's sort of that yellow line from the right superimposed with a different y-axis. And as you can see, going from July, an early spike in the fall, and now this massive spike of kids. Now, the good news, once again, on scale, if you look at the right-hand column, it's many less kids per 100,000 population admitted than adults. But one of the underlying things that is different about kids are there are less hospital beds dedicated to pediatrics. So the capacity to take care of this increased number of kids is much less than that of adults. Kids' beds, children's hospital beds, are only really about 4 to 5% of overall beds for the entire nation. So even though this spike, thank goodness, is less number of patients than adults, it's still a lot of kids. It is still a lot of kids getting admitting to hospital. It is continuing to cause a really big surge and a really big impact in children's hospitals or in pediatric beds just writ large. Next slide. So what are the issues we're seeing? And once again, I am honored to do work in the federal government trying to provide expertise in this. Children's hospitals, a rare, precious resource for our nation, but they're really feeling the strain, much like the adult hospitals. Number one is the COVID surge that I just mentioned. Number two, winter is typically very busy for children's hospitals. So other viruses, kids with viruses like human metapneumovirus, RSV, I won't delve into it. Maybe we'll get into the questions, but the mental health crisis facing our kids is really overwhelming. And it's sad the number of kids seeking or needing, I should say, inpatient care. I would also argue getting back to some sense of normalcy, which I know is a focus of IIFX, is hopefully going to bring some stability to kids' lives and hopefully make a small dent in that mental health crisis. Just when you thought there weren't enough crises, you can read the headlines across this nation. There's a blood bank crisis, that we don't have enough blood coming in to meet the needs of hospitals right now, and that's affecting children's hospitals as well. I'm not going to get knee deep into testing today. Maybe testing will come up in the comments or the questions, but there's a real pressure for children's hospitals and pediatricians' offices to test kids. That's just sort of layered on all the other responsibility that these institutions are feeling. And if there's anything that is universal between a children's hospital, an adult hospital, a nursing home, an urgent care center, the staffing shortages. We are seeing so many staff members get sick with COVID, sick with Omicron, that the capacity for the nation right now is strained. There is some hopeful data that, much like the UK and much like we saw in South Africa, that Omicron is starting to fade. Hopefully that brings a little bit more stability to the workforce. Next slide. Once again, lots of headlines across the nation, which are always very disconcerting to read because nobody wants to see a child suffer. But you can see whether it's ABC, NBC, NPR, media across the nation is really starting to wake up and say, wow, kids are not immune from this virus. They can, albeit rare, thank goodness, get very, very sick. And because children's hospital beds are such a precious resource, when you see them overwhelmed and you see National Guard troops coming to help children's hospitals, you know the nation's in a bit of hurt. Next slide. So what are the current issues? Just kind of bottom line up front, as we say in the federal COVID response. There's a vaccine for kids. There is a safe and effective vaccine for kids down to the age of 5. It prevents serious outcomes. It prevents kids from getting this serious disease called MIS-C, multisystem inflammatory syndrome, in kids, which happens about 6 weeks after COVID. However, the uptake of the vaccine for the kids recently approved, ages 5 to 12, is just around 20%. And I know there's a lot of hesitancy, and I know there's pediatricians and family medicine docs and a lot of people working on this. But the fact that we don't have a high percentage of our kids vaccinated against this terrible virus to me as a pediatrician and a parent and a grandparent is really disconcerting. It is also a work in progress. There's been other media coverage that kids less than 5 actually don't have a vaccine approved right now. And I know the FDA and the manufacturers, especially Pfizer, are working very hard to make sure that the kids' vaccine is authorized very, very soon. This is a little bit too much in the weeds, but there are multiple therapies you've probably heard about or maybe experienced for patients, adults primarily, that turn positive for COVID. Unfortunately, the one that was approved for kids down to age newborn, the Lilly product no longer works because of Omicron. And there's another therapy called remdesivir that hopefully will have a role at preventing kids, especially high-risk kids, from progressing. Next slide. So what's the bottom line, Doc? Thank goodness most cases are mild. And I think that although kids have suffered and kids have died, and that is absolutely horrible, no child should die from a vaccine preventable disease. Overall, I think we can know, or we do know, that kids are less severely affected, and the kids belong in school. Kids belong in normal activities. And I give Lou and this group so much credit. How can we get back to some sense of normalcy where kids feel like kids again? But once again, Mike the optimist, but the realist, not all cases are mild. There are severe consequences of this disease in kids. We have a vaccine that is safe and effective. And I know that takes a conversation between parents and family, but in my estimation, we're not going to get back to a sense of normalcy until more and more kids are vaccinated. I won't get into the politics about mask wearing. Suffice it to say, there is data that masks work, and really any kid above the age of 2, if they're in close quarters, should have a mask on. And I know that's much easier for me to say from a policy perspective and much more difficult to do in your individual worlds, but masks are a really important public health measure continuing to go into 2022. And kids are at the mercy of adult decisions. That's been true since the age of time. So we've got to make sure that we protect our kids. My bottom trio is get vaccinated, wear a mask when you're indoors, and stay home if you're ill. Once again, very easy to say from the rafters, really very difficult to do down on the field. But I think we've got a group of physicians here that can talk more to how can we continue to get back to some sense of normalcy and have our kids protected. So next slide. I think that is my last official slide. We looked at, thank you once again for sending in all the terrific questions. One question I got that I think was more along the lines of the pediatric response was, so what about N95 masks? It sounds like N95 is really going to be a recommendation of the CDC to keep yourself protected. Do we have any recommendations for kids? The CDC has not changed yet, underline yet, the recommendations for what kind of masks should be used for kids and in what particular age groups. This is not inside baseball information. Just my estimation is I think if we're going to recommend those for adults, and certainly the Biden administration is ramping up sending out masks, actually announced just today, I do believe there will be an iteration on the guidelines for what kind of mask is most appropriate for children. So I think much like the CDC has to iterate these guidelines on a regular basis, I do think you'll see that coming from the CDC very, very soon. So without further ado, I would love to introduce Dr. Eric Osman, who will continue our webinar, and then we'll welcome Dr. Jolly when he's back. Dr. Osman, you want to introduce yourself to the group, sir?
Yes, absolutely. Thank you, Dr. Anderson. So Eric Osman, I am an emergency physician by training and the Chief Medical Officer at Vigilant. We support a number of partners in the sports and entertainment business, but also support a number of commercial and government clients, as well as a medical advisory and operations company. So, and we'll go to the next slide. What I really want to sort of build upon is, Dr. Anderson's talk about the impact on kids. This surge is very different from prior surges. That's one of the things that's been really fascinating about COVID, is that each surge has its own flavor. And so in Omicron, and you can see in this quad chart, the number of new cases per day per 100,000 is just huge across the United States. I mean, we're seeing numbers, we never saw 300, 400 new cases per day per 100,000. So a huge number of people getting infected. And, what we're seeing in the US, which is somewhat different from other countries, is that our hospitalizations in adults are not totally decoupled from the number of cases. When you look at the UK and South Africa, one of the reassuring data points was that the hospitalizations compared to the number of cases really was not climbing a whole lot. That's not been our experience in the US. In fact, we've exceeded peak hospitalization across the country for every other surge with COVID-19. So a very different kind of surge than what has been seen in the UK and South Africa. Probably a number of reasons for that, but one of the biggest reasons is that amongst some of the most vulnerable, the people over the age 60, our vaccination programs have been good, but they have not been great, as have our booster programs in those same age ranges. So even though we are seeing a increase in hospitalizations amongst every age group, it's dramatically larger in those at risk. And we'll go to the next slide, please. And when we look across the United States, a few interesting trends that you can see in this quad chart. In the US, we're finally starting to see cases come down. And in South Africa, if you look, a 40% drop week over last this week. So, and in the UK as well. So these cases are going up quickly, but then they're also coming down quickly. What is particularly interesting to me, if you look at China with the Olympics coming up, they're starting to see a surge in cases, and this will be very interesting because China has really gone with a containment policy. Whereas in a lot of places like the United States, we've definitely tried mitigation with vaccines and other measures, but I think our containment efforts have been generally weak. So once again, globally, we're going to see a very different COVID surge depending on what country you're in and what measures have taken place prior to this date. And we'll pop over the next slide. So in the US, I think we are seeing peak in a number of locations. Now, not everywhere, but certainly in New York, we are starting to see cases come down. And so we still have 26 states increasing, but we do have 18 states decreasing this week. So I think that's very good news. Our increase is only 38% over the last 2 weeks, as opposed to 120% last week. But still a huge number of cases. And when you have this many cases, you are absolutely filling your hospitals to capacity. And that, on top of a underlying staffing shortage, is making healthcare access challenging in some locations. And as Dr. Anderson said, we have a very limited number of pediatric beds across the US. And so even though the virulence of this strain might not be significantly greater than others, just the sheer numbers tends to fill those beds up. So next slide, please. When we look out into the future, one of the things that the CDC does is really takes a number of different forecasts and puts them together into an ensemble forecast, trying to predict what's going to happen in the next 4 weeks. And based on all of the data and the various models we're seeing, it's looking like we're probably peaking this week and into next week, and then with a relatively significant decline. So that I think is probably good news as we head into the middle part of winter and then into the spring. And next slide, please. And when we look across what is causing this surge, it is clearly Omicron. In almost every state, when we do the genomic analysis, Delta has been totally dominated by Omicron in a period of 4 to 5 weeks, and this is exactly what we saw in South Africa and the UK. This is a much more transmissible strain of the virus. Somewhere in the neighborhood of 2 to 3 times the transmissibility of Delta, and Delta, as you recall, was significantly more transmissible than the original strain. So that is what is driving this rapid surge. And hopefully we will also see a relatively rapid decline on the backside. And then the final slide, please. Looking at vaccination, across the U.S., we are still struggling to reach some of the most vulnerable. We are really only at approaching 80% for the population of 5 and older receiving 1 dose. And this is particularly problematic in the over 60 population. And it is a practicing emergency physician. This is what I've been seeing for the last 3 weeks. We're getting some younger people coming in, but mostly they're interested in testing or they're mildly ill. We're not seeing younger people coming in with significant respiratory failure or, oxygen deficits. But we are seeing a number of older people who are medically fragile, have comorbidities, who come in and they get COVID, and then the COVID makes all their underlying disease worse and they get hospitalized. This is not unlike what we see with the flu. And so I think this is another sign that we're moving from a pandemic phase to more of an endemic phase. So with that, I'll stop my part of the presentation, but happy to take questions on the back end.
Eric, thank you so very much. I think Dr. Jolly is back on. I'll just keep the ball rolling. And then maybe when we get to the end, Till can sort of corral us into some Q&A. Dr. Annie Jagoda is live and with us. And Doctor, I would love to have you introduce yourself and then get to your topic, sir.
I'm delighted to be here, even virtually, and I hope one day soon we'll all be seeing each other in person. That's the dream, and we'll see the dream sooner or later. When the 1917 pandemic mess and the world was in crisis, and then what happened? We had the Roaring 20s, and the Roaring 20s were celebratory of getting out of the pandemic, and I'm hoping that we have something coming up soon. Now what we have is the roaring Omicron crisis that's on the tail of a pandemic that we're going into 2 years. I'm a practicing emergency physician. I'm past chair of emergency medicine at the Icahn School of Medicine in New York City. I have 8 hospitals under me, and in those 8 hospitals, we see about 600,000 patients a year across all 5 boroughs, or 4 boroughs in New York. And so I have a pretty good perspective. And of course, my trajectory over these 2 years, worst of it back in March and April of 2020. And then we've gone through our surges like everyone else has. My staff has the same amount of PTSD that all of your staffs and colleagues, friends, and family. We've all seen so much. And our challenge is not to let that COVID fatigue get the best of us and let we get through this. So I'm going to give you just a little bit of perspective. I have 5 minutes, and I'll try and stay within my time, but everyone accuses me of going over. So when I see my other panelists yawn, that will be my sign to stop talking. Here's where we're at in New York, and it's kind of good. I'm the optimist. Even though I spend a lot of time advising corporate America on how to get back to office, and I'm very cautious, but I am optimistic. And indeed, as has already been said, we have seen, I hope, in New York, we haven't seen the country. I think we've seen my colleagues in parts of Italy and France, where I work, have also hopefully seen the peak. But what does that mean, peak? And I'm going to take you back just a little bit. If we where we were at last October, when already Delta was hitting us pretty hard, but we were getting out of it, we were reporting about 12 cases per 100,000. That's the number that we've been throwing around. And we saw back in October about 3% of tests were positive. And just so you know, last week in New York, we 8 per 100,000, and we were 35% of tests positive. That's off the charts, crazy numbers. So I'll remind you also that the good news is Omicron's not as invasive as Delta and as Alpha. And as a result, as we've heard in the pediatric community and other communities, we're not seeing the numbers of critically ill by proportion of number of people infected. The problem with Omicron is it's 2, 3, even 4 times more contagious than the past variants. And just by being so contagious, it spreads. Remember the first time you read the Oslo Christmas party, right at Thanksgiving time. And we couldn't believe what we were hearing. 120 or so people go to a Christmas party, 60, 70 test positive within 1 to 2 days. Couldn't believe it, but it's true. And we all have seen friends who've gone to a party. And what happened? Everyone tested with an antigen test. We're all negative. And lo and behold, the next day somebody's positive. And 2 days later, half the people at the party are also positive. And what's that telling us? Because it has relevance to you and to me. And how do we get back to getting together? Because that's what we want, safe environments so we can re-socialize and get back life. So this is what we know about Omicron. It's very contagious, we've said that. And it seems to be particularly contagious 1 to 2 days before people have symptoms. Okay, we see that with other viruses like influenza. That's not news, but we forget that that's the risk. And we know our testing, in particular our antigen testing, isn't great in that 1 to 2 days before symptoms. Once you have symptoms, antigen tests are a better strategy. But before you have symptoms, maybe we're missing 20, 30% of positive cases. And challenge when we try to use testing as the ticket to get into an event, whether it's a small event or a large event. Good part, because I keep coming back to good parts, is Omicron tends to be upper respiratory, as invasive to the lower lungs, which is what was putting people into our ICUs, and it does to our central nervous system. Oh, that's fascinating, because what was the hallmark of Alpha and Delta? Loss of taste and smell. I lived in fear because I love a good glass of wine, and I was frightened that I would lose my taste and smell. I made it through that. Okay, with Omicron, we're not seeing it. Yeah, we see some people, but we're seeing very few people with loss of taste or smell, not as invasive. And if it's not as invasive, one, people aren't getting as sick. But number two, preliminary preprint, the word we're all familiar with now, preprint data is telling us that less risk for long COVID. Well, we'll see if that's true or not, but we've underscored already the problem with this virus being so contagious that our vulnerable populations, the unvaccinated, the very young who don't qualify for vaccinations, the elderly, are being tipped over. So for example, in my hospital, 800 COVID patients. Well, throughout my system, we have 800 COVID patients. Almost none of them are vaccinated and boosted. Finding a lot of asymptomatic admissions for hip replacement and knee replacement, et cetera, who just happen to test positive. But it's not the COVID that brought them in. The patients with COVID who are sick, elderly, unvaccinated, and almost all of my patients in the ICU are unvaccinated or have comorbidities, meaning cancer patients are on drugs to suppress their immune system. So this is the good part of Omicron. And it brings us then to the question of where it's going, right? So if we've peaked in New York and we've peaked at other major cities, I do remind everyone that there are parts of the country that have yet to see the peak, and we have to watch them very carefully, number one. Number two, once it peaks, the question is, what's to be the next step? The next steps, I think, for all of us is the vigilance of continuing a lot of our public health initiatives, whether it's hand washing or wearing masks, so that we stabilize, because chances are, if we look at the last 2 years, there is going to be another variant. Will it be more aggressive, less aggressive? I don't know. Last July, everyone was ready to party. And what happened? Well, we know what happened. And everyone took their masks off. We had surges. October, we're starting to look like we're in control. Take our masks off. Everyone books their Christmas party. What happens? Everyone lost their deposit because all the Christmas venues were canceled. And so all I'm saying is, as we start making our strategies, we need to be thinking, what's our public health strategy to monitor? And we're getting better at that. Remember, we were hit with a pandemic in a first world, especially in the United States, with a very weak public health infrastructure. I hate to admit that because I'm so proud of my health system, but we'll be shored up. We'll make advances there. We'll be prepared. And so there's two things that I just want to say before I'm totally out of time, and that's this. What's going to be different? Ourselves from keep having the cycle every 2 to 4 months of a new surge. And this is for the better. We have many more people who have some degree of natural immunity, though we know natural immunity isn't as good as vaccine immunity, but it is complementary. Vaccine immunity booster and past COVID infection, you're pretty good and pretty safe, but not 100% safe. We have the immunity factor that's going to help us, but remember, we're in a pandemic and we're living in the first world. A large part of the world that travels is festering and nurturing new variants. And so don't think just because numbers are down in one part of the world that the rest of the world is safe, because of course we've learned that's not the case. All right, so we'll put that there, but then we have two other new things. Our vaccine technologies are unbelievable. And right now we are working toward new vaccines, because what's the problem with the current vaccines? The variants mutate the spike so that the antibodies can't bind to the spike and you get infected. And as long as we keep changing our spikes, we have some weaknesses in our vaccination policy. But what if we develop a vaccine that identifies the fundamental, basic, non-mutating components of the virus? That's the holy grail. And they tell me that phase 2 trials with some of these newly designed vaccines, that's like unbelievably exciting. And that could be part of the solution. And then I'll remind you this. There are new treatments that we've already mentioned, but the Pfizer drug, full disclosure, I have no work with any pharmaceutical company. Paxlovid is an excellent treatment that actually blocks the synthesis, the replication of the virus. So Paxlovid is an advent that, especially in our unvaccinated at-risk group, could offer a treatment to prevent them from ending up in the ICU. So I actually think the future is looking good. I think we need a fair amount of vigilance. I hope during the questions we can talk about masks. I love to talk about the different masks and what the strategies are. Forget about N95s. People aren't going to be wearing N95s. If you look at my nose, it's red. I wear an N95 my whole shift, and my nose is going to fall off pretty soon. There is no way the American workforce 95s, but KN95s, KF94 95s, you know what? They're pretty comfortable. And you can get through a day with that just fine. And if you go to any school, that's not a problem. It's the adults that seem to be having a problem. I really appreciate everyone giving me your time.
Thank you.
Thanks, Andy. I'm the understudy for Till Jolly, so I would now turn the helm of the ship back to Dr. Till Jolly.
And thank you. Thanks very much. And everybody, we're all getting pulled in 1,000 directions. Dr. Need, I don't know if you have any thoughts to add.
Yep, I got that. You'd think by now we'd all have that one wired, but you get lulled.
Thanks.
You're listening to everybody else, and I kind of forgot that I became a participant instead of just listening. So just to introduce myself, I'm Robert Need. I'm a sports medicine and family physician out in San Francisco. I work at Kaiser Permanente, and I'm also the head team physician for the Golden State Warriors. And I'll speak from my perspective from both of those things. So both as is in the NBA, as well as in a large healthcare system and a hospital in a big city in California. And I both of these experiences are actually fairly similar in the sense that I practice in a highly vaccinated environment. And I know this is a national, maybe even international audience, and that isn't the case everywhere, but I hope it can be give you some optimism for where we can go and how things might be once we are more vaccinated. Just to give you some numbers, in the city of San Francisco, 82% of everyone is vaccinated. 62% of the city is boosted, and over 80% of our at-risk, meaning medical condition or over the age of 60, are boosted. So we are a highly boosted city. The NBA is actually a very similar experience. Other than the players, everyone in the NBA has to be vaccinated, and they all now need to be boosted as well. So both highly vaccinated environments. So what has life been like in that situation? Well, we had the same peak everyone else did, because as has been pointed out, the booster is exceptional at preventing death and significant illness, hospitalization, but it doesn't necessarily prevent you from getting infected. And so we are seeing a lot of asymptomatic. Our case positivity rate, similar to what we saw in New York, we're currently, as of today, I just wrote this down, we're at 30% test positivity, asymptomatic 20% test positivity. I mean, these are unbelievable numbers. We went from single digits per 100,000 to 350 per 100,000, of which about twice as likely to be unvaccinated. But because we're a hugely vaccinated population, you're still going to have huge numbers on the vaccinated side, right? That's just how statistics work. That said, very little serious illness. We have not seen the rush in the hospitals. We haven't seen a lot of deaths. In fact, there was just a study put out by Kaiser as a system looking at 52,000 positive hospitalizations, and there was only one death from Omicron in all those numbers, which translates to a death rate of 0.0003%. That's 4 zeros. So it's an incredibly effective vaccine. And we talk about breakthrough, and sometimes people think that means failure. It doesn't mean failure. It means it's not stopping spread because it's such an infectious disease variant, but it is incredibly successful at what it was intended to do, which was preventing the overwhelming, our hospitals from getting overwhelmed and death. As Dr. Jagoda mentioned, we don't yet know what's going to happen with long COVID. I think that's a real risk. On the other hand, at this point, it doesn't appear to be coming to fruition. Of course, you don't know you have long COVID for a couple of months, and we've only had Omicron for one. So who knows how that's going to turn out. But at least with the prior variants, there does seem to be a significant correlation with the severity of illness. And so in this case, hopefully we will not see a large number of ramifications going forward. We've definitely peaked here. If you look at case positivity rates, if you look at they do wastewater surveillance. All these numbers have plateaued and started coming down. In fact, our peak was probably this past weekend. And so I think we are, at least in this city and in the Bay Area, going to experience similar to what we saw in Europe and in New York. I think you guys are already, or in South Africa, that we're going to see that high spike and then coming right back down. So where will that leave us? It's interesting. Where you see high vaccination rate, you also see high mask utilization. How much of our success here has been because of that, I think is hard to discern, and in time we'll probably learn more. But what we're certainly seeing now is people returning back to more normal life. So I know one of the big concerns people have when we have these big surges is everything going to shut down? Are we going to shut down venues? Are we going to no longer go out to eat? And we are not seeing that. I think it's not just pandemic fatigue. I think in our population here, especially as well as in the MBA population, people feel like if it's not endemic in the country, it's at least endemic in this population, meaning we don't feel the same amount of personal risk. Everybody's got their own risk tolerance level, but in general, and so we are still going out to dinner, we're still doing events. We can get into, I think, in some more of the question and answer about what are the environmental precautions that a venue can do to ensure that safety. But the reality is with this surge, what we've really seen is the loss of the workforce. That's been the biggest impact in our medical center, absolutely, as well as in the partners that I work with, like the Golden State Warriors and others. You know, I'm sure everyone else has had this experience of going out to a restaurant and they only have takeout because there's no wait staff. And it's not the wait staff are in the hospital, they're just home quarantining. So I do think we're going to see a change in that aspect of it as we try to preserve our workforce. I think those are the main comments I just wanted to make to piggyback off of what some of the others had said here. And at this point, I'll open up to Till and to Lou if you guys want to lead a Q&A.
Yeah. Thanks very much. And thanks to everybody for your input. I mean, really, these are really a group of experts who have both, on the ground practical expertise in disease management, and then various sort of operational elements at various parts of the pandemic, and frankly, other health crises also. Robbie made a very good point about staffing, and I think I've already suggested to Lou and IIFX staff that that's an area of interest for lots of listeners on how to manage venues at a time when staffing is difficult. Any venue manager will tell you that. So I think we're not going to discuss so much the operational aspects of that, but those of you that are listening realize that's coming sort of for another day. The doctors aren't going to really tell you how to staff, but others may.
Till, if I could just make one comment about that, so just what we're doing here, just from a medical standpoint. So one, of course, is encouraging and actually mandating vaccines, which I realize is not going to happen nationally, but maybe in your individual organization, both the Warriors and the NBA and here at Kaiser Permanente, we require vaccination and boosters going forward because we know that that's so important. And the other is if we get into the antigen testing of when you get an asymptomatic or a mild illness, of using antigen testing to get a more rapid return to the workforce instead of having to quarantine or isolate for a full time-based to get people back faster. So it is helpful in that setting.
So thanks. Yeah. So Lou, we had a number of questions prior to this. So we had a lot of people that asked questions even before this. So I'm going to open it up to the group and ask a couple of things, realizing that our target audience right now are people that run organizations and run venues and are doing it and have been through remarkable times in their own right, and really try to bringing fans back into the venue safely. So maybe I'll turn back to Dr. Ostman or others for what are your thoughts on current best practices for how to bring people into a venue safely, screen them, manage them, communicate with them, and others may have thoughts on that too.
Hey, Till, so I just say a few things. One, and several people have made reference to this, and I think it's totally true. One of the challenges we're seeing with Omicron is that people are actually infectious 1 to 2 days before they test positive on many of the rapid antigen tests. So if you asked me 3 months ago, would the rapid antigen test have value screening people before they participate in a congregational event, I would say, absolutely. I think it's a fairly good tool. I'm somewhat questioning that now because of what we're seeing with Omicron. I think there will be further development in this area. I think, temperature screening has really run its course. It's not been overwhelmingly successful at presenting or preventing people from coming into a venue or into a congregational setting that are infectious. I do think there are a number of interesting things on the horizon, particularly with wearables and monitoring various parameters to determine whether or not, someone is potentially infectious, but currently not here. So I think state of the art as we sit here today is probably ensuring that people are fully vaccinated as best you can, and that you're communicating to the group that is attending that really, don't come in if you're feeling unwell and
All right, and we may have lost Dr. Osman. I will tell you that he's lost his video because of a weather event. So other emergencies do happen.
But Till, I would add to that. It's all about risk, and I'm all in favor of people wanting and getting back to various venues. The individual has to decide their risk and need to be reminded. If everyone's vaccinated, I think that's the common denominator, and boosted. If you wear a good fitting mask, you have minimized your personal risk. And therefore, of course you can go. And you might decide not to take your mask off to eat a hot dog or drink a beer or whatever you're going to do. That's your decision, but you can safely go. You can go to Broadway. You can go to a sports event. You have to decide, and you have to be aware of what's the risk for the people you then come in contact with. And then you put that into your own personal rubric. If you have a 90-year-old mother living in your home, you really might not want to be attending that venue, or you'll be meticulous about your KN95, putting it on correctly and taking it off correctly. And you know what? You're still protecting your mother.
So a couple of additional thoughts. The masking thing is a hard one because I think when the data has kind of waxed and waned as the different variants have come, and different masks have been encouraged and used. And we're seeing more and more that the common cloth mask, especially if it's not really fitting very well, probably is not doing a lot to protect anybody. And even if everyone in the venue is masked, maybe that's not doing much. And of course, we know in any given venue we go to, half the people around you, the mask is around their chin. And it's hard to ask the staff to constantly reminding people. I know when I go to the basketball games now, the ushers are constantly reminding people, and that's a really hard thing to do. So I do think that the future is going to involve more of this individual choice. It's no longer going to be, I'm wearing my mask to protect you, you're wearing your mask to protect me, but more, I'm going to wear a mask that protects me. And now I need a KN95. Or if I'm really concerned, then I wear an N95, and they are hot. If they are working, it means that they're sealed and that they're uncomfortable. But I think that's a way, and I think that will become more accepted. Certainly, I live in a city which, based on SARS and on MERS, remember this is our third coronavirus pandemic in the last 20 years, we already had a population that was comfortable wearing a mask in public to protect themselves, and they weren't necessarily looked at askew. And I think we will see that going forward in big venues. The same will be for your staff. So that was the question I get from our staff is really, how do I protect myself from the 700 people I'm going to interact with in the next 2 hours? I think masks and staff are probably going to be with us for a while. Our venue mandates a booster. You cannot come into the Chase Center without a booster. That makes our environment entirely different than it is in a place that doesn't have a high vaccination area. We have not seen fewer fans. They are still coming, even though you need that. So I think that that's a possibility. Of course, I don't know anything about ventilation. The building people can talk to us about that. I agree that testing is not going to get us out of it. And as the numbers come down, the prevalence goes down, the test sensitivity rate will go down. That's just statistics, and it really isn't going to be a helpful model. So I think it's high vaccination rates. It's wear a mask if you personally feel that risk, and then all the education about staying home.
So thanks. So I will turn a little bit. We've touched on a number of issues related to methods of screening and the uncertainty of those and risk management. I don't want to end this without talking a little bit about mental health and behavior. We know that the venue operators certainly are dealing with significant behavioral issues and increasing anxiety and other things directed at their staff. And we see this in a clinical setting. I know we're going to lose Dr. Anderson in a few minutes, but maybe starting out with a discussion of what the mental health aspects have been related to children and adolescents, and then we can talk about how that affects adult behavior also. Mike?
Yeah, Till, I'll take a quick shot, and I do apologize. I have to go at 1 p.m. Eastern. I want to thank you for bringing it up. It was one bullet point in my slides, and I probably didn't emphasize it enough. The mental health crisis for kids going into the pandemic was bad before the pandemic, and that is just the needs versus the resources able to care for those kids. And I was in Dr. Need's neck of the woods for 4 years at UCSF Benioff Children's Hospitals, a wonderful world-class, terrific children's hospital, a great partner and neighbor with Kaiser Permanente. And yet, even in these great children's hospitals, we didn't have enough resources to meet all of the needs of kids, whether it was anxiety disorder or eating disorder or you fill in the blank. Add on 2+ years of not being in school, not being seen by trained eyes, and that is coaches, and that is teachers. I've been so impressed on these webinars when we've had coaches on them talking about, they're a really important link in the chain, that the coaches are often seen as role models and can also alert folks when, little Jimmy's not doing too well. So I think this 2 years has really been tough on kids. And that's why I credit IIFX again. How do we get back to some sense of normalcy? I will say from a purely children's hospital perspective, and I think it was Eric that brought it up, children's hospitals are just a precious resource. And there's so many kids waiting for beds for mental health that we're in the rafters. I do think there are solutions. That is getting kids safely back in school, so there is some sense of normalcy. I think it's supporting our family medicine, our pediatricians who are trying the best they can. That's medium term, sort of short to medium term. Long term, this country has to grapple with, we need many more resources for kids. But I once again credit this organization and everybody on here for, can we get back to normal soccer? Can we get back to taking my kids to a game at the Chase Center and feeling safe? And I think we'll get there. It's just, it's a big crisis until I really appreciate you bringing it up.
Yeah, maybe Andy or Rob, if you have thoughts, if you have thoughts on this, particularly as it relates to, there's the emergency department crisis question, and then there's how it results in what happens in public behavior, and then Rob, how your staff in the Chase Center has to deal with that.
Listen, we've all seen the numbers of increased number of violent outbreaks, whether it's on airplanes or road rage. It is a stressed population that had a mental crisis before COVID, and it's all been accentuated now. Part of just what we're doing of putting it in the open and having the discussion is step number one, and leadership is responsible for at least putting mental health on the agenda, because by just acknowledging that there is a mental health problem can sometimes open the door. Our problem, as you know, is mental health is under-resourced, and finding access for mental health care is very difficult. From a group point of view, our huddles, our team debriefing is a first step, but we have many employees who need care. And I'm not sure if anyone here has checked out what it costs to get therapy. It's expensive. And so we're entering into a very difficult phase and an expensive one. And I'm not sure it's going to make the budgetary agenda, unfortunately. But I'll tell you this, a lot of the anxieties and PTSD isn't treated with a pill. Patient resulting from some of these issues. And I think we need a lot of very smart people getting together to figure out some of the common fundamental interventions that can be provided.
Great. And Rob, in your sort of travels around the Chase Center, what do you see among the staff? I mean, what are they having to deal with on a practical level?
Our experience, I think, has been pretty positive. Of course, I'm not the expert. I'm not overseeing the staff in this area, but what I'm seeing and hearing about, obviously, they feel it's a difficult situation to be put in to have to monitor the fans in that way, especially if that's not traditionally been your job. You've been there more as a host and not as security or an enforcer of some kind. I know that lots of folks that are running arenas are doing education for their staff around that. I will say that our experience has been pretty benign. I have not heard anything about, like we hear about on the airport, in the airlines, et cetera. Sometimes those things are anecdotal stories that the media exacerbates and, it becomes, oh, this is a huge thing. People have been pretty good about it. That said, I see them reminding the same person over and over and over again. And so I think that's the bigger issue. It's not so much that people are going to get belligerent. It's that it feels a little bit like they have no power to do anything about it. The Chase Center, in response to that, is now told all ticket holders as they enter that they have the right to be removed if they are not wearing their mask. And so setting that precedent. I do not know that anybody has been removed, but that is certainly part of the PSA announcements that come out over time is during the events and venues. I kind of go back to I don't know that the mask is the most important thing, similar to the hygiene theater that we do is necessarily the thing that is going to prevent people getting sick in one of these events. I think some of this goes back to the individual's responsibility to be vaccinated and if they feel uncomfortable wearing their own mask.
There was a question. I'm just going to very quickly address it about multiple cases. Yes, people do get multiple cases of COVID.
Yeah.
There's a question about herd immunity. It's probably not a great term, and immunity certainly isn't absolute. And we're still learning about this, so it's not kind of a cop-out answer. But I think it's a difficult question that many people with expertise in immunology and infectious disease have struggled with. Before I turn it back to Lou, I will turn one more question back to Eric and the group. Any specific training tips or guidance that you might have for venue operators, given all that we've talked about?
I mean, Till, I think awareness and communication is really the key. As we've discussed, it seems like we spend a lot of time like trying to enforce mask wearing on a very small number of people, where the vast majority sort of understand and comply. And so I think a lot of the employees and team members are in a really difficult situation. And so I think communication both to your fans and also to your team members is essential at this point, because as you said, we're learning a lot of this as we go along, and that's the situation we're going to be in for the next 6 months. So with that, over to you.
Great, thanks. Lou, I'm going to turn it back to you if you have questions for the group or comments or guidance for the participants on where we go next.
Well, I think, first of all, let me thank all of you. You've been advising us very well through the last 2 years. And I think what I'm excited about today is the fact that our audience, our profession, is getting the right information. It's been difficult with the word information and communications. And it's been hard for us to manage these venues and events and not knowing exactly what the proper policies are, et cetera. But I think today you helped us greatly understand the undertow of what's going on and where. I think you helped us a great deal with, what are the potential solutions down the road that can help us manage our venues and the protocols, particularly out at Chase Center. And Dr. Dean, I know working very closely with the crew there that you're certainly a model for us in the United States when it comes to how to manage events during this rough time. And that's what Dr. Jolly, I think that's our next step here for the nation is next month, hosting a town hall on how to manage these large gatherings, mass gatherings, and what precautions should we take and how can we operate effectively so that we're maintaining a safe environment. So I think that's an outcome from this particular town hall. But I just, again, it's so important to get the right information. And many highlights came out of this particular session here. And the big one I'm taking away, and I'm sure the rest of the attendees, is the fact about mental health, the welfare of our staff, the welfare of all of us. What's the reaction to mental health in the future? because of the COVID environment. And there was a strain on us even before COVID, and that really doubled it up. So what's the next step when mental health in relation to our country, to our sports and entertainment industry as well? So that's one of the big takeaways, Dr. Jolly, is we're going to still be a different nation. All right. We're not going to be the same, in quote. We have a lot to learn from this, and a lot of changes will take place. And I thought Andy said it well. The allocation of resources to meet these demands is going to be very interesting from the government down. So we'll see. But listen, thank all of you again for a great town hall. I think our people appreciate it. And thanks again. Okay.
Thank you. Everybody have a great day.
And then I just wanted a couple of things here to close up to Dr. Jolly. We want to carry this conversation on. We got a town hall next month, but as we look down the road in May, IIFX, we did reschedule our conference based on input from the medical community to May 24th to 26th of May in Las Vegas. And I think there's where we want to continue to carry on these discussions. The world may be different in May than it is today. That's what I heard today. But we'll look at the innovative changes driving the fan experience in our industry. And certainly one of the changes is certainly what we discussed here today. So we'll get into it a little bit more so in May. And so that's what I want to tell the audience, that we have a continued effort here to get us back to work, play, and spectate. And part of it is these town halls and certainly the conference coming up here in May. Okay. Well, folks, want to say thank you. Thank you again, physicians, for a great town hall experience to help us, and appreciate it. And we'll stay in touch. Okay. Thank you. Bye-bye now.
Bye.